a very exciting time.
And I just know that it's going to be great for the delivery of care.
What we're about is offering a high quality service.
It's 15 years in the making.
I believe that this will be good not only for the service users, but also for staff.
It's bigger and better, and it really is the right environment for getting the care right for our service users. This is our new psychiatric intensive care unit, and what it is a special unit to offer care for our service users when there are those times when they might be most frightened and distressed and in need of the most intensive care and support that we're possibly able to offer them in hospital.
So you would have people with, schizophrenia, bipolar personality disorder.
We've invested for the new PQ around 4.5 million, and that was very much done on the back that we looked at our current PQ environment and felt that it wasn't appropriate, it wasn't fit for purpose.
For far too long, hospital-based mental health care has been in the sort of dingier buildings that haven't looked great. And what does that say about mental health care?
It was too small, it was too cramped, and it didn't lend itself as a healing environment.
Over the years, there's been renovations, there's been a lick of paint here and there, but it does not by any chance do what this new PICU is going to do, both for the staff and the patients that we seek to serve.
I think what we're saying here is that we're absolutely serious about mental health care being just as good, and I would say better than healthcare that you get across the whole of the system. How the new building and the old building compare, it's like night and day. Literally, it's like the dark old building and this fantastic new bright, spacious environment. It's going to be brilliant for patient care. Some of the things we've got here include a much bigger, better lounge,
interview rooms,
multi-sensory room,
therapeutic spaces to do interventions,
better, larger bedrooms,
got a prayer room,
and a much better de-escalation room when people are really unwell that includes its own ensuite facilities and access to outdoor spaces.
There's even a staff room, so it's not just about the patients but also ensuring that the staff that are going to be working with the patients are also looked after.
Even those parts of the unit for people when they are the most poorly and need of the most intensive care, even those parts of the building have got access to outdoor garden spaces so people can still see the sun and the sky. It's absolutely fantastic.
Service users have told us what's worked for them, what hasn't worked for them, and we've taken that on board, and we've worked with a really first-class team of architects and builders and people like that have really come up with a design that we feel is fit for the 21st century and beyond, and we're really proud of it. I think Interserve, as our partners in this project, have worked really well with us. There's been very good communication, and throughout the project group have reported back some really good working relations with them.
As a doctor, me and my colleagues have worked closely with Interserve throughout all of this, and I think that's really important, bringing together the clinical and the contractors, and by doing that, that's what's enabled us all to deliver this fantastic new building. What this new unit says about our trust strategy is that we're absolutely committed to providing the best possible care for our service users whenever they need it and wherever they need it.
The board have made some very big strategic decisions on where it wants to go as far as inpatient building-based services. We want to provide high quality services both in inpatients but also in the community. We also looked at our trends over the past couple of years and how much PQ we were using both in Sheffield but also out of Sheffield, and felt to ourselves that what we could do was do a lot better job in supporting people who are going through that crisis period to stay in Sheffield and be a part of family, community networks, but also continue along the care pathway that they were on. So we see this expenditure as a part of a longer term plan to improve the quality of our estate and our environment. I think the board has gone a long way and has been very brave in making decisions on taking this forward.
It's going to be a benefit for patients, no doubt. When you're in hospital, and particularly on a psychiatric intensive care where you've got very little opportunity to leave, that is your living space and you spend 24/7 in that space. So to have a bigger space to reside in, to have a brighter space where you can have some privacy, where you can have more of an opportunity for individualized care, it's only going to be better for the patients.
I honestly believe that a better environment has an impact on patient care. I mean, how can't it? If you're unwell, where do you want to be? You know, sort of cooped up in a dark space or in this fantastic new modern bright hospital. But I would say it's not just about the building, it's about the fantastic care that our team are working towards delivering, and not just here in hospital, across all of our services, including in the community.
I'm very excited that what we're going to have is the entrance of a building and a PQ that we can be proud of.
Part of somebody recovering in mental health, you need to be at peace in every aspect of your life, and your environment is your foundation. It's where you can start your recovery. If your environment is chaotic, it's dirty, it's limited, it's dark, how on earth are you going to recover? How on earth are you going to build any sort of hope that things can be better and should be better? Now, if your environment is nice, it feels safe, you're content and happy in that, that is surely going to do so much for your mental health.